thank our many co-sponsors who helped get the word out about this program. Peace Action Bay Ridge, Peace Action New York State, New York City War Resisters League, Tree of Life Educational Fund, United for Peace and Justice, and World Can't Wait. Now, I'd like to introduce our speaker, Dr. Alice Rothchild. Dr. Rothchild will speak for 15 to 20 minutes, followed by a Q&A, a session moderated by Bruce Altschuler. Please put your questions into the chat. About Dr. Rothchild. She is a retired OBGYN who worked in the healthcare reform and women's movements for many years. Since 1997, she has focused much of her energy on understanding the Israeli-Palestinian conflict. She grew up in Sharon, Massachusetts, where her family belonged to a conservative synagogue. She served as an assistant professor of obstetrics, gynecology, and reproductive biology at Harvard Medical School until November 2013, and currently retired from clinical medicine, serves as a corresponding member of the faculty. Alice developed an interest in progressive politics during campus opposition to the Vietnam War and moved on to her discovery of feminism and health reform movements in medical school. She also became an active in social justice organizations and contributed to the publication of Our Bodies, Ourselves, remembered fondly by many of us. In 1997, she turned much of her non-medical focus to understanding and writing about the Israeli-Palestinian conflict and its relationship to US foreign policy and American Jewry. She organized a number of health and human rights delegations to Israel-Palestine. She has worked with local and national groups and is now active with Jewish Voice for Peace on the national level as a member of their Health Advisory Council and is on the board of the Gaza Mental Health Foundation, Just World Education, and We Are Not Numbers. She has published books on Israel-Palestine, Broken Promises, Broken Dreams, Story of Jewish and Palestinian Trauma and Resilience, 2007, On the Brink, Israel and Palestine on the Eve of 2014 Gaza Invasion, 2014, and Condition Critical, Life and Death in Israel-Palestine, 2017. She made a documentary film, Voices Across the Divide, which co-won the 2013 Audience Award at the Boston Palestinian Film Festival. She has contributed to anthologies on women's health and Israel-Palestine. She is also a poet, is currently working on books for children, and just last year published a young adult novel. She blogs when inspired or particularly outraged by the state of the world. I am so honored to welcome Dr. Alice Rothchild.
Well, thank you so much. And I'm going to make this smaller. Okay, so I'm going to be talking about the health and human rights consequences of the war going on in Gaza. Now, the first thing that I think we need to be aware of is that healthcare in Gaza is provided in the context of a siege, checkpoints, closures, curfews, a strict permitting system that entails everything and every person that goes in or out, the separation, the apartheid wall, militarized fence along the perimeter, multiple Israeli incursions, massive assaults, detentions, and factional violence. And I think if we're thinking about health and human rights, we need to think about some ethical questions. We need to think about the role of international law and collective civilian punishment. What happens when a population has severe restrictions of access and is ghettoized? What happens when there's a large amount of incarceration, especially of children? And then the whole issue of the proportionality in war. And we need to remember that healthcare and healing occur in a socio-political context. And what that really means is that we need to have political solutions to health and human rights issues. And it's important to ask, why is life expectancy in Israel 10 years more than in the West Bank and Gaza? Why is maternal mortality 9 to 10 times greater in the occupied territories than in Israel? Oops, sorry. So I'm going to read this slide because this is your take-home message if you only remember one thing. More than 75 years of Israeli domination and dispossession has affected Palestinian life through occupation, siege, annexation, de-development, and permanent displacement of refugees, severely impacting the ability of Palestinians to access the essential building blocks of health. The fragmentation of society and destruction of the ability and opportunity to create essential institutions involved in healthcare has created a reality that is recognized today as medical apartheid, two separate systems, two separate realities. And we clearly see this in the disparities in life expectancy and maternal and infant mortality. Now, medical apartheid happens because of a deliberate Israeli policy of de-development of the healthcare system. So the Israeli government does not allow equipment to get in, critical medications to get in, the building blocks for building better hospitals to get in. They have a severe permitting system. So if a patient needs high-level care in East Jerusalem or Israel or Jordan, they have to go through bureaucratic hoops to get the permit, which is not guaranteed and sometimes comes late. And as I said, there's a chronic lack of critical medications and equipment. Then there are the direct attacks on healthcare facilities, and the area has a high level of conflict-related trauma. Now, I'm going to speak about health in its broadest sense, the right to health. And this is a list that was developed by Physicians for Human Rights Israel, a group that I've worked with. So we're looking at the freedom of movement and access to health services, and then the kinds of things that make up a healthy society: clean water, sanitation, adequate nutrition, housing, education, employment, and the ability to live in a nonviolent society. The picture on the right is a patient education pamphlet from the Palestinian Medical Relief Society. So along with pamphlets about taking your vitamins and breastfeeding your baby, this is a pamphlet on what to do if you're in labor and stuck at a checkpoint. Now, I keep mentioning international humanitarian law. This was codified in the 4 Geneva Conventions of 1949 that protected civilians in times of war and treated as war crimes the murder of civilians, torture, rape, and hostage taking. So these laws are part of international law, a body of rules that are governing relationships between different states. Now, over the years, there have been additional protocols and other agreements prohibiting, for instance, the use of certain weaponry or military tactics. And then in 2000, there was the protocol to the Convention on the Rights of the Child on the involvement of children in armed conflict. Now, if we look at healthcare in Palestine, it has been defined as fragmented and incoherent. We have the Ministry of Health, which was established in 1994 after the Oslo Accords, to set up a healthcare system and run it. Now, we also have the United Nations Relief and Works Agency, or UNRWA, which was set up in 1950 to develop a healthcare system as well as housing and education for the refugees from the 1948 war. So in Gaza, there are 8 very overcrowded refugee camps comprising 70% of the population, 23 in the West Bank, and then more in the remainder of the Arabic-speaking world. Then we have non-governmental organizations like the Palestinian Medical Relief Society and private providers. And overlaying this is the role of the Israeli government in active de-development. Now, as of this month, more than half of Gazans 2.3 million people are now sheltering in the Rafah area in the south. So they're living in tents, rickety shelters, and rubble with a desperate need for food, shelter, water, medicine. And you should note that Netanyahu has recently ordered the evacuation of these civilians because the Israeli military is reportedly planning a ground invasion of Rafah in their attempts to, quote, defeat Hamas. And they're talking about developing safe zones, but anyone who's studying this area understands that there are no safe zones. There is nowhere to go. And many of us are worried about an impending massacre. Now, I have been to the region almost yearly since 1997, since 2004, and I've been to Gaza 4 times, sponsored by NGOs and invited by the Gaza Community Mental Health Program. The last time I was there was last August, right before the assault. So over the years, I've done direct services and women's empowerment groups and a lot of documentation, and I'm also involved in a number of organizations that work in Gaza. Now, before the 2023 aggression, there were 13 governmental hospitals, 142 primary healthcare centers run by the Ministry of Health, UNRWA, and NGOs, approximately 40 private hospitals, 2 medical schools, and then a whole bunch of professional schools. But there's a total mismatch between the staff trained available and the positions available. So there were 120 nursing positions in Gaza each year and 5,000 nursing students. There are less than 20 psychiatrists in Gaza, and less than 7 of them are physicians. And before the assault, there were some very major health issues. One was the lack of electricity, 48 hours a day at erratic times during the day and night. Severe fuel shortages. The fuel is for running ambulances and for generating electricity, and sometimes hospitals had to close. And then I've talked about the restrictions with the permitting and the medical equipment shortages. There's an extreme lack of specialists because doctors can't get out of the strip to train, and the medical personnel is exhausted. Very often their salaries are unpaid, and they were pretty decimated by the COVID-19 pandemic. Now, what we are seeing also is an issue around UNRWA funding. So you should remember that the funding for UNRWA was slashed by Trump. It was then partially restored by Biden, but at that point they were running so thin that they were threatening to cease operations. Then on January 26th of this year, the Israeli government accused UNRWA of having 13 workers who participated in the Hamas assault. And in response to that, without any major investigation, and despite the fact that those workers were fired and that UNRWA has a very intense policy of neutrality, 13 countries voted to suspend all funding of UNRWA to the tune of $667 million. Now, there are other things going on that a lot of people aren't aware of. So in the US Congress, there are bills to eliminate UNRWA and stop aid to countries that fund UNRWA. And in Israel, there are all sorts of moves forcing UNRWA to vacate training centers, charging them with huge usage fees, evicting them from their headquarters in East Jerusalem, limiting the visas for international staff, revoking their tax-exempt privilege, suspending shipment of UNRWA goods. Israeli banks have blocked their accounts, and hundreds of UNRWA staff are refused access to all their headquarters and schools and health centers in East Jerusalem. And on January 31st, Netanyahu said UNRWA was, quote, in the service of Hamas. And many Israeli officials are calling for donors to cease funding. And this has been a long-standing Israeli goal. But I think it's important to remember that this would undermine the education, health, and other services that are essential to the human rights and continued existence of Palestinian refugees created in 48 and 67. So in the midst of this, we have 2.3 million Gazans, 50% of them under 18. So as of this, 2 days ago when I made the slide, we see the total disintegration of the healthcare system. There are now over 30,000 people who have been killed in the war, over 70,000 injured. In Israel, there were 1,162 people killed during the Hamas attack. In Gaza, in terms of Israeli soldiers, 238 have been killed, 1,400 injured, and there are about 136 hostages in Gaza. If you look at the pattern of Israeli airstrikes, the Israelis have bombed homes, civilian gatherings, markets, houses of worship, bakeries, restaurants, banks, ATM machines, crowds of people waiting for food, hospitals, healthcare facilities, ambulances. There's a full electricity blackout and a severe lack of electricity. So at this point, 12 of the 36 hospitals are partially functional, the rest are not. And there's massive overcrowding because people run to the hospitals thinking it's going to be a safe place for shelter. And I just want to make it clear that according to international law, if a hospital is functioning as a hospital and is full of patients and people having surgery and women having babies, that it is against international law to bomb the hospital. We know that over 60% of the housing units are destroyed or damaged, and 75% of 1.7 million people are internally displaced in all sorts of horrific sheltering situations. There's a severe shortage of water and medicine, and the risk of famine and starvation. And this risk is not in the future. There are people that are currently starving. There are people that are having one meal every day or every other day and eating animal feed. And with all of this horror, there are increasing intercommunal tensions and increased gender-based violence. And we also estimate that there are 50 to 60,000 pregnant women. Now we see, looking at the Israeli attacks, a deliberate attack on healthcare. Hundreds of healthcare workers have been killed, 121 ambulances destroyed, 161 UN staff killed. So more than 2/3 of the hospitals and health centers are no longer functioning. There have been no medical permits to the West Bank or Israel. Clinicians are reporting major unusual burns on the dead and wounded, suggestive of white phosphorus, which is a weapon illegally, it's illegal to use it in urban areas. And women on top of this have almost no menstrual or hygiene products. Now we see that this obviously impacts the mental health of everyone. It's particularly true for children who have been documented as developing from their experiences convulsions, increasing bedwetting. Bedwetting has always been a chronic problem for kids in Gaza. Massive increase in aggressive behavior, nervousness, and refusal to leave their parents' sides. And UNICEF has now declared that Gaza is the most dangerous place in the world to be a child. At the Rafah and Kerem Shalom crossings, we have trucks carrying food, water, and medical supplies. There are hundreds of them, and they're intermittently let in small trickles. Once they get in, they're often mobbed by people who are starving. And if they get through that mob, then it's almost impossible to travel because everything is bombed out. There have been intermittent telecom blackouts. The universities, libraries, archives, museums largely have all been destroyed or damaged. Now we see, looking at agriculture, major damage to over 1/3 of all cropland, 1/5 of all greenhouses, almost 500 agricultural wells, and most of the agri-food infrastructure. The water, 95% contaminated, and the infrastructure to deal with this and to distribute it is destroyed. Most sewage pumping stations and all 5 wastewater treatment plants have been shut down. So now we see raw sewage continuously pumped into the Mediterranean Sea, where people are bathing, cleaning their clothes, and sometimes drinking the water. We see rising levels of things like chickenpox, scabies, lice, diarrhea, respiratory illnesses, hepatitis A, significantly on the increase, and over 6,000 people waiting for transfer for treatment abroad for high-level care. And there are over 10,000 cancer patients who are at risk for dying due to lack of medications. And we also see an increase in the denial of humanitarian missions by the Israeli government, particularly when it comes to the north, where the suffering is at its most extreme. We see Israeli protesters blocking aid trucks at the Kerem Shalom crossing. And also in the environment, there is a high risk of explosive ordnance and unexploded ordnance that needs to be cleared for people to be able to move around. And in the midst of this, Palestinian armed groups are continuing their indiscriminate rocket fire into Israel and fierce on-the-ground fighting. And then in the midst of all of this are the civilians, and many human rights groups and legal groups are now looking at this and saying it rises to the level of genocide and repeated war crimes. Now, I just want to mention something about pregnant women. There are about 5,500 births per month. I wrote an article about this. It was published in the New York Times, if you want to track it down. Most of these women have no prenatal care. Many of them are internally displaced, and most of them do not know where they will deliver. So there are about 180 women a day giving birth without adequate care. There are women who get to the hospital, sometimes dying on the way to the hospital. They get to the hospital. They're having cesarean sections, sometimes without pain relief. If a woman delivers in the hospital, she's usually discharged within hours of the delivery because there's such an onslaught of people coming in. And then she's discharged, to a tent or to an apartment with 30 other family members. So women are giving birth in shelters, in their homes, in the streets amid the rubble, in overwhelmed healthcare facilities. The sanitation is horrific. The risk of infection and medical complications is on the rise. This woman just had a baby in Rafah in a tent. Now, I mentioned that there is a lack of food and clean water and problems with starvation and dehydration, and that's true of the general population. This is particularly problematic for pregnant women, breastfeeding women, and babies because they are incredibly vulnerable. So this situation impacts the health of the mother and the baby, as well as the mother's ability to bond and breastfeed. Now, a starving, dehydrated, stressed out woman is not going to be able to breastfeed well, so she needs formula. She has to have money to buy the formula. She gets the powder if she's lucky. Then she has to mix it with the water, which is contaminated with E. coli. So this is a compounding catastrophe. So we expect to see rising maternal deaths. We're already seeing rising fetal deaths. And there's a psychological toll that also has consequences on reproductive health. There's been a documented 300% rise in stress-induced miscarriages, and we expect to see rising congenital abnormalities, stillbirths, and premature births, having all this putting together a multi-generational impact. Oops. Now, as you may be aware, South Africa has lodged an 84-page complaint in the International Court of Justice accusing Israel of a pattern indicating genocidal intent. Genocide was defined in the 48 Convention as specific acts committed with intent to destroy, quote, a national, ethnical, racial, or religious group, acts including killing members of the group and deliberately inflicting on the group conditions of life calculated to bring about its physical destruction in whole or in part. Now, the court will take months to come to a final conclusion, but they did come up with a preliminary conclusion where they stated that South Africa has standing, that this could be a genocide, the Palestinians are a protected group. They reviewed the horrific conditions in Gaza and the racist, fascistic, dehumanizing language coming out of many Israeli ministers. And they said that Israel must take action to prevent genocidal acts and increase aid and report back in a month. So this report was due yesterday. I've heard that Israel submitted a report. I haven't seen any information about it. And they called for the release of hostages. So when we step back and look at this whole picture, I think the crux of the problem is that the status quo can only continue if we as human beings see Jews as more human, more deserving, more innocent and honorable than Palestinian Arabs. If we as a total community are blind to Arab suffering and the history of settler colonialism. So the fundamental issue comes down to racism, which potentially leads to ethnic cleansing and genocide. And from all of this, we can see that the health of Palestinians is intrinsically linked to their liberation and end to siege. Another crux of the problem is the behavior of the United States. You may know that the US just again vetoed another UN Security Council resolution for a ceasefire and blocked the demand for an immediate ceasefire that was favored by 13 of the 15 member states, and including the vast majority of the nations of the world. Thank you. So I think we're now going to do a Q&A.
This is a very depressing presentation, I think it's fair to say. So we will, at the end of the forum, Rusty Eisenberg will present some actions that you can take to try to do something about the situation, however modestly. So keep that in mind. But for now, please put questions in the chat. First question we received in advance asked, what is the impact of the assault on Gaza on the healthcare system in the West Bank?
So what's happening in the West Bank, people are calling it the Gazification of the West Bank. There has been a marked increase in settler violence, and Netanyahu and Smotrich and Ben-Gvir and all those kinds of right-wing folks have basically unleashed the settlers on Palestinians, particularly in Area C, which is the 65% of the West Bank that is totally controlled by Israel. So there is a huge amount of trauma and killing. I think there have been 400 people killed so far, destruction of homes, massive amounts of trauma happening in the West Bank. I haven't seen direct attacks on hospitals, but I could be wrong on that. But the population itself is suffering massively from injuries and death and home demolitions and displacement at a marked increase level from before October. And so what we see is that under the cover of war, the settlers and the Israeli government are really trying to seize as much land as they can get and drive Palestinians off that land. And the other thing that's happened is that there's a total closure. And so, the thousands of Palestinians who were working in Israel are not able to do that. So there's rising levels of poverty and difficulties getting to healthcare. It is almost impossible to get to East Jerusalem for high-level care. So the whole area is shut down. People are restricted to stay within their towns and villages. They have to get permits to move from place to place, and it's basically largely shut down. So you can imagine that not only is the economy impacted, but people's health is impacted because they can't get to healthcare, they can't get their medications, they can't get to their tests because they have to, their towns are all shut down. So I think that's where the impact is primarily happening.